And we have a system today that's really designed for profit more and more, unfortunately. We've become very corporatized. Part of that process is patients are losing in that battle.
Losing financially and losing, from a healthcare perspective, right?
Right, their health.
Yeah, their health.
Right, and their health is a big part of their value.
Welcome back to the Only Healthcare Podcast. If you've ever asked yourself, why is it so hard to get care? Or why is my insurance so expensive? This episode is for you. Today we're breaking down the actual U.S. healthcare system crisis in plain English. Despite spending more than any other country on healthcare, we rank at the bottom of outcomes like life expectancy, chronic disease, and preventable deaths. Why? It's not your doctor's fault. It's not your fault. It's the system. Let's dive into what's really broken and how we can fix it. Randy, take it away.
Thanks, Michael. There's so much going on today in the healthcare system in the United States that makes it very complicated for individuals as well as anybody who's in the U.S. healthcare system. Some of the data that came out of the Commonwealth Fund and other sources, including the government, talks about the U.S. spending more than any other developed country on healthcare, looking at the gross domestic product, the GDP. Yet we rank last in the quality of care, access, and health outcomes. So part of what we're struggling with today is, so what is it costing on a per patient basis? So we look at spending that would be done on a per capita basis of around $12,000 per person on U.S. healthcare. The ranking that we see in the latest data among peer nations across the world, again, looking at the global perspective, we rank last in life expectancy. We were at the top. Now we're starting to head towards the bottom. So money has not been the necessary evil here, but the problem is, what are we getting for value out of the dollars that we're spending? We still have the highest rates of obesity, diabetes, and mental health. Challenges continue. And again, this is coming from independent sources outside the government as well as inside the government. National Institutes of Health is another one that provides this kind of data, Health System Tracker, and there's many others out there. So we're back to, well, if we're spending all this money, where's that money going? And why does that matter? So the money that we're spending today, if anybody has been in the healthcare system, you might see your primary care physician. But more often than not, if something is urgent or it's something that's done off hours, maybe on the weekend, where do they tell you to go? First place is the emergency room.
Yeah, urgent
care.
care.
So now you're in the hospital. So trauma and emergency care. So it's not just have you had an injury and you're helicoptered in, God forbid, to the hospital. But if you're walking into the emergency room, that's the highest, most expensive part of the U.S. healthcare system that you can go to. So it becomes very expensive, not only to provide the care, but what it's going to cost you as a patient. It's also going to cost the health plan that is covering your medical care, because most of this we're talking about today is about the medical benefit. So it's among the world's best care when we look at emergency care, but it is also the most expensive. So those dollars don't go as far as you would expect. So if we look at the primary care that we were talking about, that really is part of what we call the preventative care system. So if we're able to prevent a chronic condition getting worse or progress and so forth, then we'd be in much better shape. But right now we're failing. And so that's what's represented in this global reporting that I was talking about earlier, that we are spending the most money, but we're just not doing as much to get the outcomes that we really should be getting out of the money that we're spending. So it's estimated that somewhere between $600 billion to almost $2 trillion, trillion, is considered wasteful spending, according to an article in the American Journal of Population Health in 2020. So this was during the pandemic, and it's only gotten worse in the last few years.
But when you talk about money, there's the act of trying to get care, right? And then there's the act of having insurance. And do you think insurance should start from the first dollar, or should insurance be implemented like later for things that are significant, that are unachievable financially.
So if you look in the commercial healthcare insurance market, that's the dominant market in the United States. Prevention is kind of put in together with everything else. It's all like one big bundle, and then it's broken down from there. So the problem is, so what happens with what you're talking about, preventative care, primary care as a specific example. And there's been a devaluation over time of payments being made to primary care practitioners. So it could be the physician, it could be a nurse practitioner, physician assistant, et cetera. Anybody you'd see for a lot of the chronic conditions, because most of us, we have some kind of a chronic condition or multiple chronic conditions. So it makes sense to try and figure out how can you prevent that condition from getting worse or progressing over time to a point where now you may be at end of life care in some cases. So the problem is insurance really isn't covering a lot of this prevention because the assumption is that the patients or the consumers and members of these plans would be taking care of themselves to a certain extent. So some basic activity like lifestyle issues, walking, running, going to the gym, et cetera, what they eat, the diet, along with the lifestyle, and doing some things that are in their best interest. And we've gotten further and further away from that over time, kind of like a yo-yo of sorts. Sometimes we're good at it as a country, sometimes we're bad at it. So it's become a problem of, so where are you doing that? And there is a movement now to kind of go back and look at what we used to call health and wellness. How do we support that better, even though it's not necessarily covered by insurance in many cases? Interestingly, that's part of the debate that's going on today in the Medicare program, which is an insurance program by the federal government. And they have a program, which is Medicare Advantage, which generally includes some of these preventative services now at no charge. So you can join a gym, you can join the Y, you can get some other basic services.
And the government pays for it?
And the government's paying for it. So some of the commercial plans, particularly in the larger employers, have incorporated a lot of that, and they've been very supportive from a culture of healthcare perspective within their business to try and encourage people to take good care of themselves, to make sure that they're eating well, they're doing some exercise. Some of the larger tech firms, as an example, have for a long time had gyms in their facilities, not just one facility, but in every building. They have a gym. They'll have resources available, and this is all at no cost. Unfortunately, most employees and most families that are covered in commercial insurance are not in that situation. They're mostly in the small to mid-sized businesses, mom and pop businesses, and so you're not going to have that. So that becomes more of a problem. So where's some of the cost drivers coming from? So if they're not spending a lot of money on prevention, and prevention is the most cost-effective way you can spend your money, where is it going? Well, a lot of it's going to administration. So administration of the organization, administration of the plan, so all the paper shuffling, accounting that has to happen. There's also some pharmaceutical price gouging that occurs and has been talked about. And another episode talks more about that we've already covered, so I'm not going to spend a lot of time on that. But there's a lot of factors that go into that pharmaceutical pricing issue. And then finally, the problem of really knowing or not knowing, in the case may be, about the hospital billing for services, which includes all the physician fees, the nursing services, the drugs that they may be using, some of the imaging services, and so forth. So either we don't know what's going on, so we're not able to look at it and say, well, do I really need this as an individual who's getting this care? And can I even shop around a little bit? We don't really have that option right now. So that's all contributing to this cost problem that we're seeing.
What would good look like given what's happening today? Like on the basic level, not, pie in the sky, but on the most basic level, what could people do? Because talking with patients, they're frustrated with not knowing pricing, right? Like you said, but they're also frustrated with, why is my premium going up so much every year? Why am I paying $2,000 a month for insurance? I don't even use it. Like thank God my kids are healthy, or I'm healthy. And yeah, maybe I do some prevention, right? Maybe I have a gym, but then the next year comes and they get whacked with a $300 or $400 increase per month to their premiums.
Right. Yeah, it's kind of like car insurance in a way. It's great until you need it, and then when you use it, and then you get dinged on the backside. So healthcare has some of that too, unfortunately. And so all this is contributing to the most expensive system in the world that we have here in the United States. There's a lot of middlemen. You can get into interrupted care issues where you may have to have prior approval in order to get some of these hospital services, or infusions of products is a very common problem. There's a lot of that in the news these days as well. So this whole issue of how patients and providers of care have been disconnected from one another to a certain extent. And so if you're able to get a patient to be more thoughtful and engaged, and they're given the information to help them make better decisions, which we're starting to get more of those tools and those services, not only through the internet, but just in the normal communities, talking with one another, learning about what's happening and what you could be doing is a big part of this. So if we get that really basic communication going, and you have the information available, then you're able to start getting to the next level and start asking more sophisticated questions and have more discussions with your care provider, your physician, or whoever it is you're seeing for your particular issue, so that you're really getting what you're going to really follow up on and use as a therapy, whether it's a drug or exercise regime or whatever it happens to be. Because the biggest problem we still have is, as human beings, we say, yes, we're going to do that, and then we never do it.
Is there any systems out there that are really well managed and manage the costs really well and give great care and have great outcomes?
So from a healthcare system perspective, we look at some of the private clinic operators like Cleveland Clinic and those type, Leahy Clinic up in the Northeast, and others. Mayo Clinic in the Southwest is growing rapidly as well. And a lot of them started in looking at very efficient primary care systems. So annual screenings, immediate follow-up, very efficient use of time. So you would go in, even if it was for an annual physical, and they would do top to bottom, and then they would be able to determine earlier in the course of a disease that you had that condition, and they would start treatment and start doing things. So that's one way, is right from the very beginning.
Yep.
And
how about like a Kaiser or like a
Kaiser,
Geisinger, those types of systems?
Geisinger is another one, like the Mayo Clinics and so forth.
Yeah.
Kaiser's a little different because that's more the HMO. Geisinger has an HMO component to it as well, which is a health maintenance organization. We used to have Harvard Pilgrim Healthcare and Harvard Community Health Plan, all those same idea.
Yep.
So they were all looking to try and do a better job around primary care, and the screening, early detection is the most cost efficient thing you could do. And we've gotten away from that in a lot of different ways. So the systems now, they're driven more by specialties increasingly. They try to use a lot of the technology to help keep the glue there and maintain efficiencies, but it's been a struggle. Most every healthcare system, a hospital-based system, today uses some form of a electronic platform that a patient would be able to enter. So the good thing is now patients have access to more information about the care. The problem that we're seeing in the marketplace is, instead of maintaining the communication between the provider and the patient, which used to be only face-to-face, and then have it augmented by this IT capability in a platform, is everything's migrating to the IT platform, and people are pushing everybody to that rather than that face-to-face communication. So even though we've gained information, we've lost that connection even more than we had in the past. So it's kind of an interesting conundrum. And this is even in some of the best hospitals that we've seen around the country. So part of the counterbalance of this has been some of the larger employers, through some of their enterprise programs, have tried to create a different culture and mimic what used to happen in some of these clinics and best performing hospitals. There's also other tracking programs that look at kind of a red, yellow, green light system. So who's really doing a good job, or where there's opportunities for improvement. So a lot of this comes back to how are we constantly reviewing and improving the program. And the program still has to have that human being connection, which is getting harder and harder to do. And with artificial intelligence, AI coming into play, it's probably going to make it more difficult, because we see that even if we're going to go buy a phone these days, a mobile phone these days, it's pretty rare that you're talking with anybody. It's all done electronically. It's done through bots, and it's shipped to you, so you never really interact with a human being necessarily, unless there's a problem. And so that's where the costs start to go up in healthcare. Is so once you have that problem, you need to be talking with people. And then if they're all in their silos, which is what's happened with these specialties, and I know several people recently that have been going through this problem, they see their primary care, they're referred into the correct specialist. The specialist then only focuses on that issue. So all the other issues that primary care was dealing with kind of fall off the table. So the person gets better on that particular specialty issue, but begins to have problems with all the other medical issues. So they're not looking at the patient in a holistic fashion. And so this is the challenge now that we're faced with, is how do we take these systems that are out there, we're going to add in AI to it, but how are we going to maintain that human connection and make sure that things don't fall off the table as we move back and forth between primary and specialty care?
Mm-hmm. And do you think that the any Kaiser or Geisinger or Mayo or Cleveland, is there things people can do to put a strategy in place for themselves, right? So that they're kind of building these relationships proactively, right? Because there's, whether you have AI or tech or data or whatever, you still have to have somebody prescribed. You still have to have somebody check you out, right? But how can they seek care in a way that can help and put a strategy in place to help them bring it all together?
So I think it's the individual has to be more proactive about their own health, number one. Number two, then what are the resources that are available to them? So yes, you may have a hospital. Yes, you may have physicians. There's a lot of areas where we have what we call deserts now for healthcare, whether it's for primary care physicians, even specialty physicians. It's pretty common to have deserts. Now even pharmacies, we can have a pharmacy desert.
Oh, really?
Where you can't get to a pharmacy.
There's not a pharmacy local.
So this is a continuing area that is being looked at. How do we get back to where we were in terms of the individual person being able to access care, both the primary care and the specialty care, and that there's more communication with everybody. And the patient has to be, as I said earlier, a little more proactive and start reaching out and say, okay, if something should happen to me based on my family history, or if I've been recently diagnosed, do your research, do your homework. What's in your area? Do you need to travel, or can you get it done within your geographic area? In some cases, you have to go to some other place. There's been a lot of medical travel. So it used to be you wanted a heart transplant, you were flown around the country to whatever the heart transplant center was.
Yep.
Today we have a lot more options. So it's understanding, what do you have in your backyard versus where do you have to go to get something.
Yep. And then again, you have to you almost have to be your own advocate, right? So
absolutely,
if you don't really have, necessarily, if you don't have a connected system, you don't necessarily have somebody pushing you. You have to kind of do it yourself, and people just don't know. It's interesting, in my opinion, when you look at, medi-spas that have popped up everywhere. People are excited to go get their Botox and Juvederm and all that stuff, but they don't focus on the inside part,
right.
what's happening on the inside.
And that's part of this disconnect that we've been seeing. Yeah. And if you have the financial resources, which let's just use the 80-20 rule, 20% have the financial resources so they can do whatever they want, go wherever they want, and no big deal. But 80% of the people, that's a problem. So this all adds to that cost problem that we have and the outcomes issue that we're dealing with, where people aren't in good health, they're not maintaining their health, and they're not improving their health over time. So all this is adding cost to the system and cost to the individual as a result.
Yep.
So those are some of the things that have to be looked at in a more generalizable way. How can we do a better job? How can the patient do a job better as well as having the caregiver and the options for caregiving? We're seeing the other trend out of the hospital care moving to the home setting. So how do you get a provider of services in the home? This is a very common problem today for many people.
You mean it's for like a nursing home patient, or you just saying?
No, this is for anybody post-op.
Oh, post-op, yeah.
You don't stay in the hospital long anymore.
Right.
You're moving through. And a lot of the rehab. So you had a surgical procedure, maybe orthopedics is very common. Most of your rehab is done at home. You're not in a facility anymore.
Yeah.
So again, it comes back to when you're going through this as an individual, you need to be asking a lot of questions and getting the information up front. From the service provider side, there's lots of opportunities to improve their efficiency and communications. Those kind of go hand in hand. So getting back to, as part of the solution, continuous quality improvement in what you're doing, and making sure you're interacting with that patient as part of that continuous improvement, because that's where a lot of the increase in care costs are showing up, where somebody ends up in the emergency room because they didn't pay attention to a particular aspect of their health.
Got it. So wrap for me the human toll. What is the human toll on all of this?
Human toll is we're not living as longer, as I mentioned at the top of the episode. So that's kind of the final note there. But we're also looking at struggling with social determinants of health. That's been widely reported. How are we going to do a better job with that? It's not just seeing a provider. It's, can we even get to the provider? Can we afford the prescriptions? Are we being discriminated against for whatever reason in different parts of the country? And all these impact outcomes. So outcomes is not just a one-to-one. There could be up to 9 different reasons why outcomes happen the way they are right now. There's misprevention opportunities, which I've already talked about quite a bit, and this lack of transparency around information continues to be a problem. So it makes it hard for those individuals to make informed decisions. Generally, Americans are pretty good. If they have the right information, they can make some good decisions. So it's a real opportunity there to do that. And we have a system today that's really designed for profit more and more, unfortunately. We've become very corporatized. And part of that process is patients are losing in that battle.
Losing financially and losing, from a healthcare perspective, right?
Right, their health.
Yeah, their health.
Right, and their health is a big part of their value, particularly if they're in working age.
Any last points? Because I'm going to take us out.
So I think looking at U.S. healthcare overall, there's a real opportunity for individuals to get more engaged.
Yep.
I mean, that's the big takeaway for me, because of this broken process that we have, all the inefficiencies and the costs, because we're paying the toll as individuals.
Yep.
So you have a real opportunity to do that.
Cost is driving both access and quality down, not up, like you said, right?
Exactly. So we're out of the dynamic that we should be in, where there's more balance. So we have a healthcare system that not only is costly, but it's out of balance in a lot of different ways.
Yep. So the wrap then, I'll just say that the U.S. healthcare system, it's not failing because of bad people. It's failing because of the processes. Cost is driving down both access and quality. So that's affecting, because of the corporatization and the profitability versus the patient care. The fix starts with transparency, simplification, and accountability. Empowering employers, patients, and providers to remove intermediaries is essential. And they have to take control of that and not necessarily complain about it, but actually do something about it, which is really, really critical.
Yeah, I think that last point, lack of action and being engaged, whether you're the patient or you're the plan sponsor who may be an employer in this country, you got to do something. Doing nothing is not an option anymore.
Right.
So, well, on that note, I'd like to thank everybody for listening to this episode of the Only Healthcare Podcast. Hopefully we've unpacked a tough truth today. The U.S. healthcare system isn't broken because of a bad medicine. It's broken because of a bad structure. but that means it can be fixed. If we focus on reestablishing trust, cutting out waste, and putting power back to patients and providers, we can build a system that works for everyone. Be sure to share this episode with your family, colleagues, or anyone who's frustrated by their healthcare experience. Until next time, stay informed and stay empowered.
Thank you for tuning in to the Only Healthcare podcast. We hope you found today's episode insightful and informative. Remember, our mission is to provide actionable and inspirational insights on how we can improve healthcare cost, care, and accessibility for all. If you enjoyed this episode, please subscribe, rate, and share with your friends and family. For more resources and updates, visit us at onlyhealthcarepodcast.com. We'd love to hear from you. Let us know what topics you'd like us to discuss in future episodes. Until next time, stay informed, and together, let's navigate the journey to better healthcare.